Hi, my name is Stella. I'm the nurse. I'm here to teach you about your condition.
Hi, so my doctor said that I have asthma, and he briefly went over what the medication is and like what it is, but he went over it very briefly, and I'm still confused. Like, what is asthma? Like, I thought it was something that athletes get after they exercise and they overdo it, and just something that occurs.
Asthma is a condition where there's inflammation and narrowing of your airways. This prevents oxygen from adequately flowing into your lungs, and it can make it difficult for you to breathe. It can be triggered by various environmental factors such as dust, pollen, dust mites, mold, and it can occur in any genetically susceptible individual and not just in athletes.
Okay, so how do I deal with this? How do I manage this?
Well, you can manage asthma by taking the correct medications. So you were prescribed 2 different medications, Flovent and Ventolin. Flovent is a medication that is used to reduce the frequency and the severity of the asthma attack. This is the red inhaler, and you need to take this twice a day, once in the morning, once in the evening, preferably around the same time each day. Ventolin is a blue inhaler. It is used to relieve the asthma attack. And when you experience symptoms such as coughing, wheezing, difficulty breathing, and chest tightness, you need to take 2 puffs of this medication immediately to relieve the symptoms. You cannot mix the medications. For example, if you use the Flovent to relieve the symptoms of an asthma attack, it will not work. So remember, Flovent is a medication that is used to prevent the asthma attack. Ventolin is used to relieve the symptoms of an asthma attack. So can you describe what I just explained to you in your own words?
Yes, okay, so Flovent is used for me. I'm going to use it twice a day, once in the morning, once in the evening, preferably around the same time in the day. And then if I get an asthma attack, I will use Ventolin so I can take away my symptoms. But I just don't understand, why am I taking a preventive puffer if I can just, if I see any signs and symptoms, I can just take Ventolin and then I'll be done.
Well, even if you're not experiencing any symptoms, you still need to take the Flovent regularly to reduce the frequency and severity of the asthma attacks. Even if you're not experiencing any symptoms, your airways can still become inflamed and damaged, and over time, your asthma symptoms will get much worse.
Okay, so how does this medication work?
So this device is called a meter dose inhaler. It's the exact same medication I showed you earlier, it's just that your medications will come in colors of blue and red. So the number here at the back indicates how much medication you have remaining. So this canister contains 120 meter doses. So if this number is close to 120, it means that you need to get a replacement medication before it runs out. And so if you're opening a new package of medication, or if you haven't used this device in over weeks, you need to start priming it. So what you do is you need to remove the cap, shake it for 5 seconds. Even if you don't need to prime it, you still need to remove the cap and shake it for 5 seconds. So you need to position yourself in an upright sitting position, tilt your head back, exhale completely, and seal your lips around this mouthpiece. And you need to push down on this canister while you breathe in to administer your dose. And after you're done, you remove the device and you hold your breath for 10 seconds. And after you're done, you exhale. If you need to take another dose, you need to wait a full minute before taking it. If you need to take another dose of Flovent, you need to make sure you rinse your mouth before each dose because to prevent throat irritation. And you need to also remember to clean your medication once a week to prevent clogging. So what you do is you need to remove the canister and you need to rinse the device with warm water, and then you need to dry it completely and then put the canister back in before using it again. So can you describe and demonstrate what I just explained to you?
Yeah, sure. So what I'm going to do is to prime it. If I haven't used it, I'm going to shake it. and then I'm going to take the cap off, spray it, and then make sure it's away from my face. And then if it is primed, I'm going to shake it for 5 seconds. I'm going to take off the cap. I'm going to sit in an upright position. I'm going to tilt my head back, exhale. Then I'm going to press this while I inhale. Once I inhale, I'm holding my breath for 10 seconds. Then I exhale. And I'm going to rinse my mouth every time I use this, and I have to wait 1 minute before I can take another dose. To clean it, I'm going to disassemble the whole thing. I'm going to wash under warm water, wait till it dries, and then assemble it again for next use.
So medication is not the only way you can control your asthma. You can prevent asthma attacks by reducing your triggers. Do you know what your triggers are?
What do you mean by triggers?
So asthma can be caused by environmental factors such as dust, pollen, cigarette smoke, and animal dander, and many other factors that exist in your environment. So when you're exposed to these triggers, you can get symptoms of coughing, wheezing, difficulty breathing, and chest tightness. So have you experienced any of these symptoms when exposed to these kinds of triggers?
I can't really think of anything other than when I moved into my new house. It is a basement apartment, and it wasn't exactly the most sanitary, I guess, of conditions. When I went in, it was all moldy and dusty in there. So I did a deep cleaning from top to bottom, cleaned the whole house, but the mold keeps coming back. Unfortunately, at this moment, I can't afford to move out to another place or stay in a different place.
Well, for starters, you need to remove the mold and dust mites that may be triggering your asthma. These are common asthma triggers. So what you can do is, since dust mites thrive in an environment where by eating the skin that sheds from your body, you need to thoroughly clean your home. You need to regularly vacuum and wash the linens from your bed. To prevent mold, you need to keep your house dry, reduce the humidity, and keep it well ventilated. You can reduce the humidity by using a humidifier.
Okay.
So there are many other triggers that can cause your asthma. So you need to be aware of the common triggers and monitor your symptoms in response to when you come in contact with these triggers. So in summary, we talked about how to control your asthma by using the correct medication and reducing the environmental factors that may trigger your asthma.
Okay, yeah, that's what we did go over. So I'm gonna try my best to kind of like follow what you said, limit the triggers and avoid them as much as I can. I'm gonna be taking the medications as you told me, so I can keep myself in the best condition that I can be.
Okay, so now we'll be reviewing your asthma action plan that was created by your physician. So what this is this will indicate how well you're controlling your asthma and what to do when your condition changes. So the symptoms in the green zone indicate that your breathing is normal and you have no trouble sleeping, and that you can participate in normal activities. When you exhibit these symptoms, it means that your asthma is under control. When you exhibit symptoms in the yellow zone, you exhibit some symptoms such as wheezing or coughing at night, and you will not be able to participate in normal activities in your life. And this means that your asthma is getting worse. If you exhibit these symptoms for 4 days and this condition does not improve, it means that you need to contact your primary asthma care provider to change the medication or change the dosage. If you exhibit symptoms in the red zone, for example, your breathing is difficult, you have difficulty walking or talking, and if the symptoms don't improve after 10 minutes after administration of your medication, it means that this is an emergency and you need to call 911 right away.
Okay, all right.
So we talked about how to use your medication, how to identify your triggers, and what to do when your condition changes. Do you have any questions or concerns you would like me to address?
No, I think everything's all right.
Okay, so if you do have any questions, here is a asthma pamphlet. This will tell you more about your condition, and at the back there it gives you a website called asthma.ca. It will give you a more reliable information on how to manage your asthma. And if you have any questions about how to use your medication or about your medication in general, you can call the pharmacist.
Okay, all right.
So here's your pamphlets and your action plan.
Thank you. I'll look over these when I get home. Thank you very much.